everyone, and welcome to The Swallow Coach. I'm Ianessa Humbert, speech-language pathologist, swallowologist, and your swallow coach. Today we're talking about a question I hear all the time. What is a swallowing disorder? And just as important, what it isn't. Because a lot of people are walking around worried, confused, or minimizing symptoms simply because no one ever explained this clearly. A swallowing disorder, also called dysphagia, means that something in the swallowing process is not working as efficiently, safely, or comfortably as it should. It does not automatically mean choking, it does not automatically mean feeding tubes, and it does not mean you've done something wrong. It simply means the system is having trouble. Swallowing isn't one movement. It's a highly coordinated sequence involving your brain, your nerves, more than 30 muscles, your respiratory and gastrointestinal systems. All of that has to happen in the right order, the right speed, every single time. A swallowing disorder happens when any part of that system breaks down, even slightly. In this video, one major goal of swallowing was not met. That is, protecting the airway from ingested material. The other major goal is moving food or liquid efficiently into the stomach without leaving residue behind. This video clearly shows how an inefficient swallow leaves behind significant residue. Dysphagia can affect nutrition, hydration, breathing, health, and quality of life. So understanding swallowing disorders really matters. Here's what surprises most people. Swallowing disorders don't always look dramatic. They can sound like, food gets stuck. I cough when I drink. It takes forever to eat, and I avoid certain foods now. Also, I feel mucus and phlegm in my throat. I'm afraid to swallow even though tests look normal. I choked once and it still affects me. Pills are impossible to swallow. All of those can be signs of a swallowing disorder. But let's clear up a big myth. Choking is not the same thing as a swallowing disorder. You can have dysphagia without ever choking, and you can choke once without having a swallowing disorder, in the same way that you can trip, fall, and hurt yourself, but not have a walking disorder. Dysphagia is about how well the system works overall, not just emergencies. Swallowing disorders can happen for many reasons. Neurological, such as stroke, brain injury, Parkinson's, ALS, multiple sclerosis, and dementia. Head and neck cancer or radiation. Reflux or airway sensitivity. Aging-related changes. Muscle weakness. Anxiety, intubation or long hospital stays, and so much more. But how many people have swallowing disorders? An estimated 600 million worldwide. 1 in 25 adults in the US annually, 50% of Americans over 60, up to 60% of head and neck cancer survivors, up to 75% of nursing home residents, up to 75% of stroke survivors, more than 80% of patients with Parkinson's or ALS. 25% of all infants and children have had or have a feeding or swallowing disorder. You should pay attention if swallowing feels scary, feels effortful, is worsening over time, limits what or how you eat, makes you avoid social meals, leaves you coughing, wet sounding, or short of breath. But remember, these are signals, not failures. The good news? Swallowing disorders are often manageable and sometimes very treatable once they're properly identified. Understanding what's happening is the first step to improving safety, comfort, and confidence. But this is very important. You need imaging to diagnose most swallowing disorders, just like you need X-ray to confirm a broken bone or an MRI to confirm a stroke, you need imaging to see inside the throat. This can include endoscopy. Here you see the throat and voice box when this person is talking, then while swallowing, and then again while talking. Unfortunately, it's very difficult to see the actual swallow with endoscopy. But the modified barium swallow study shows you the swallow. Here is a patient with an inefficient swallow who is trying to swallow pudding but requires multiple swallows. And here is the same patient, a little apprehensive about swallowing a pill, but is ultimately successful. Now you know what a swallowing disorder is and what a swallowing disorder isn't. But does your healthcare provider? Dysphagia is under-recognized in healthcare worldwide. Although swallowing disorders aren't well understood in healthcare, there are swallowing specialists who are trained to help you identify and manage your swallowing disorder. This channel is sponsored by Swallowing Wellness, an outpatient clinic located in Bethesda, Maryland, that provides diagnostics and treatment for people with swallowing disorders, as well as virtual consultations for individuals anywhere in the world. You don't have to navigate swallowing concerns alone. You can learn more at www.swallowingwellness.com. If this was helpful, like, subscribe, and share, especially with someone who's been worried about swallowing. I'm Ianessa Humbert, your swallow coach, improving health one swallow at a time.